Hi guys, today we're going to talk to you about another research article that I was reading and reviewing. This one is done by Dr. Ann Mucha and several of her colleagues. Essentially, this one talks about what kind of screening tools can we be using to help identify people who have concussions. So interestingly enough, this one was kind of focuses on using vestibular ocular screening methods to see if someone does or does not have a concussion. So right now, maybe if you've had a concussion, you'll realize that a lot of the screening tools that are used are more question based with regards to how you're feeling, what symptoms do you have, and now we know that it's not always the best tool to use because things can fluctuate. It doesn't give us all that much information. So with regard to this article here, it kind of evaluates the patient's ability to do pursuits, to do saccades horizontally and vertically. It looks at their depth of convergence. It looks at the vestibular ocular reflex in the horizontal plane, and it looks at kind of the visual motion sensitivity that the patients may have. Based on how they perform on these tests, you're given kind of a grading scale, and that can kind of help dictate or tell us if the patient has a concussion or not. So what they found with their research here is that by evaluating these tools, it actually gives quite a high predictability in identifying if someone has a concussion versus someone who does not have a concussion. So for those of you who have been wondering, that's kind of great information to have, because this is kind of one of those things when you're looking to get treatment or you're looking to get help somewhere, that's definitely something that I, as well as what you can see in this article, is highly recommended that you get tested on yourself. It is a great screening tool, but it's also a really good thing in terms of practicality and application for how you can get the treatment further down the road. So this article is very well done. It talks a little bit about some of the other tests that are currently used, kind of like the BEST test for balance, the SOT test for sensory evaluation. There's a few tests it talks about in terms of being those other tests are a little bit more static in nature. This one's a little bit more practical in terms of we're looking at the functional eye movements of what might be making you feel dizzy, what might be giving you some headaches, what might be giving you some of these kind of these skews or these perceptual differences that you may have after you follow a head trauma. So again, if you're interested in this article, I'll attach the link below and you can have a read for yourself, but it's super great. It emphasizes some really important points that at my clinic I like to highly stress in terms of using it for all of our concussion patients.